Hello everyone and welcome to another day of high yield USMLE questions. Today we will be talking about pediatrics. So a 2-year-old boy presented with a recurrent episodes of crying for the past 4 hours. During these episodes he draws his legs towards the abdomen. He is playful between the episodes. So between the episodes the patient is fine, but during the episodes is when he draws up his legs towards the abdomen. There is a history of gastroenteritis a week ago. There is a mass palpated on the right side of the abdomen. What is the likely diagnosis? So remember these. They said crying, and they also said it draws his legs up the abdomen. So these are the clues that the patient is in pain and there is this episodic pain. Sometimes they will not use the word pain in the question on NVMEs and in UWorld, but you can suspect that it is painful when they say that the patient flexes the legs, or when the infant flexes the leg or draws up the leg. So those are the words that they would use for a boy or a child in pain, who is in pain. So remember there's also a history of gastroenteritis and there is a mass palpated on the right side. So this is definitely looks like it does look like a case of intussusception. So here they said inflammation. Let's see the options. So inflammation of the appendix, this will be appendicitis. Remember, mass will not be palpated in appendicitis unless it led to an abscess or there is something else. But also remember there is usually fever. Here they did not give any fever. Here they said episodic pain, so usually it won't be episodic pain. So that does not look like the right one. Colonic polyp, remember, wouldn't cause abdominal palpatory mass unless it's some sort of maybe a cancer. But palpatory mass usually will not be seen. There is usually bloody diarrhea. They did not give any bloody diarrhea. But remember, intussusception, you do get bloody, current jelly stool. So why is it current jelly? Because there is mucus plus blood. So when mucus and blood mix, they give jelly-like appearance. So that's why it's called current jelly, because the current jelly is also like red. So then with the telescoping of the proximal into the distal colon, so this is the intussusception. So remember, this is the answer here. So, and I told you they may not use the word pain. They will say draws up the leg during episode, and it's usually episodic. And also they gave a history of gastroenteritis a week ago. So usually the rotavirus, for example, can cause it, and the reason for that is because of the hypertrophy of the Pear's patches. So remember, what happens is that the most common location is the ileocecal location, and this is why on the right side, which is on the right side, so this is why there is a mass on the right side that may be palpated. So they say olive shaped mass usually. So let's say if you have this is the ileum, and this is the cecum. Cecum is this big thing. So and let's say it kind of goes in the cecum. So that is basically, this is called this is the proximal, which is the ileum, and this is the distal bowel, which is the cecum. So ileocecal is the most common. So this bowel should end here, at this level, but it went beyond it, and into the beyond it into the cecum. So that's out into the distal bowel. So this is intussusception. This is called intussusception. And so here you can get like a lot of pressure on these walls here as well. So it can cause ischemia eventually and necrosis if it is not treated, and it can lead to rupture perforation. So remember, if they say rupture perforation, the features that they will say is guarding rigidity or hemodynamic instability. So if those things are seen, guarding rigidity, then you can directly opt for surgical management. So otherwise, the management for this is for intussusception is just add enema. So you like if this is the colon, and let's say I'm drawing here the transverse and then descending colon. So you put air, right? You push air through the colon, and it actually pushes it back in towards this way. So that is the treatment. It is also therapeutic and diagnostic for intussusception. And remember that the reason that gastroenteritis would cause it, because here we have the Pear's patches, and when the contraction of the intestine come, it can actually take this. It causes a disturbance in this contraction of peristalsis and push it into the distal colon. So that would be the reason for that. PEADS patches. Remember, if it's a recurrent, this is the first episode, but if it's a recurrent intussusception, think about the lead points. The lead points can be macula diverticulum, for example. It could be a tumor, for example. So when they say about recurrent, this is the first episode in this patient, but if it's recurrent, let's say 3 or more episodes, then you can think about at lead point. So this is the right answer here, and told you enema is used as treatment and is also therapeutic, and it's also diagnostic. So then gastroschisis is also wrong, because usually it won't present at 2 years. It will be at birth, and you can actually see the intestine without covering membrane. If it's a covering membrane, that's called omphalocele. Seal for, it is sealed. So and gastroschisis is not sealed. It is just open intestine that you can see. It won't be mass palpated, but you can actually see the mass. So yes, and if they say like between omphalocele and gastroschisis, which one is worse, so pick omphalocele, because omphalocele is more associated with chromosomal anomalies. Gastroschisis is usually just alone. So you may think that, okay, so omphalocele has a covering, so it may be like better one. But you may be right, but the thing is that in omphalocele you get a lot of associations, like the chromosomal anomalies like trisomy 21. So hope this video was helpful. This was something about intussusception. They usually ask in PEADS. If you like the channel and the videos, please like and subscribe. And if anyone wants tutoring, you can email me here. And if you like the videos, or if these videos help you, you can consider supporting the channel here in link in the description. Thank you for watching.